Hello, my name is Lucy Aquino of Hispano Care, a program of Advocate Illinois Masonic Medical Center, and you're watching a live interactive show on CAN Cable 21. During the next 25 minutes, we're going to be discussing affordable assisted living. With me today is Wayne Smallwood, Executive Director of Affordable Assisted Living Coalition, and we invite you to call in with your questions. Our lines are open. That number is 312-738-1060, and it's at the bottom of your screen. Our phones are now open. Welcome, and thank you for being on the show.
Yeah, thank you. It's wonderful to be here. I love Chicago this time of year.
It is, and it's just gone right into spring, and it's very green out there, and it's funny how you're cutting your grass already.
I know.
Went straight from winter to summer, full blown.
How true.
Affordable Assisted Living Coalition, as it's known as AALC, is Illinois' a leading non-for-profit organization dedicated in shaping the future of affordable senior housing in Illinois, and with the hopes that the answers to the growing need for affordable housing with services dedicated to elders and persons with disabilities. In Illinois, prior to the introduction of supported living concept in 1996, financial means often forced senior citizens into nursing homes where their benefit would cover the cost. The paradox was that within nursing homes, the highest cost exists and the lifestyle component tends to be less desirable for those who do not require higher levels of skilled nursing care. At the time, it was estimated that as many as 30% of seniors and persons with disabilities who lived in nursing homes could live more comfortably and economically within assisted living type programs that would cost the state far less to operate. And that's what we're talking about. Assisted living, supportive living. So, Wayne, what is supportive living?
Well, supportive living is Illinois' model of affordable assisted living, and it offers people of any income the opportunity to have supportive living or assisted living services in an apartment-style living. Mm-hmm. So it's everything you mentioned in terms of offering a higher quality of life and also the capability of controlling your own lifestyle much more than you can in a nursing facility, which is controlled much more by the regulatory environment. Mm-hmm. In supportive living, we have the opportunity to serve people of any income. And you can't see it on camera, but I'm wearing a little puzzle piece that represents the missing piece. We call ourselves the missing piece of senior living, because the affordability allows anyone of any income to live in supportive living buildings.
So it's for persons obviously with disabilities, our seniors, regardless of income, apartment-style living with hospitality and healthcare services that would help them stay independent.
Yes, and one of the key features of supportive living is that element of monitoring the health status of people. So for seniors, which is most what the model accommodates, that age starts at 65. So anybody 65 and older who needs or may otherwise need some assistance with their activities of daily living, the bathing, clothing, dressing, once in a while eating assistance. Those people could be appropriate for supportive living, and we find that they are very much attracted to the model. So let's talk a little bit about who can qualify. Obviously, you already mentioned age 65 and older. And those with disabilities between the ages of, and we didn't say this, but disability between the ages of 22 and 64, correct? Correct. There is a minimum number, there are a minimum number of facilities that serve persons with physical disabilities. In fact, 5 of 119 operating buildings in the state of Illinois currently serve people who are that physical disability age range 22 to 64. But the great majority, 114 of the 119 operating facilities, serve people 65 and over.
That has grown tremendously in the number of buildings that are available.
Very much so, and we've seen a big growth the last 3 or 4 years as the Department of Healthcare and Family Services, the Illinois Department of Healthcare and Family Services is the state agency that oversees the program, and they've been instrumental in allowing a controlled growth of the program so that there are more and more facilities in all levels of our society in terms of suburban, urban settings. There are 20 operating in the city right now, another 15 under development.
Oh.
There are another 20 to 25 in Cook County outside of the city. And then it operates throughout 73 of 102 counties in Illinois. So it really serves all levels, and it works in a rural, urban, or suburban setting.
It's quite spread out.
Quite spread out throughout the whole state, from southern Illinois all the way up to Chicago, and from the border at Missouri and Iowa over to Indiana. So we've got them all over the place, and it's really gratifying.
Sure do. Now, you mentioned that you have others under development, and what's the more or less date for some of those to become operational?
Generally, once the department approves their business plan and gives them okay to move ahead, it takes around, believe it or not, this is something that surprised me, around 3 to 5 years to see a property really get developed, because you have to arrange financing, and then you have to deal with the construction part of it. So all that, it takes much longer to develop than you would think. But we've still seen a tremendous growth over the last 3 to 4 years, with approximately 50 or 60 more buildings being added to that total to get us up to the 119 operating sites around the state.
Well, that's still quite impressive, considering as to when you started all this.
Yes, and
that has grown.
Illinois has the largest such program in the country, which is another thing that most people don't realize. And we're able to serve people of all incomes, but especially those with low or moderate incomes who may need Medicaid assistance. This program operates under a federal waiver program, which is another way of saying experimental or alternative program to institutional care. So this program operates under a federal Medicaid waiver, and we can serve over 10,000 people per year with Medicaid funds in this program.
Wow.
So it's the largest such program in the country, and we're very proud of that.
Well, as you should be. Now, I know that just as an apartment, you need a lease. Can we talk about what is required, what are the requirements for someone who is coming on board, or someone who's interested in looking into leasing an apartment? What are their income levels? Do you accept? And obviously, a lease, like anything else, one has to sign one.
Exactly. And it's in supportive living, there is a rental lease required, and the lease runs from year to year. So each year you sign a new lease. And for Medicaid to help you with your service cost, you must have income that is no greater than $2,939 a month. I know that's a strange amount, but so roughly $2,900 a month. And the annual income, and this is quite surprising as well, if you multiply that times 12, you'll come up with $35,268 per year.
Oh.
With the average retirement income in this country being $27,000 a year, you can see that here in the Chicago area, we can serve incomes even greater than that, which is very helpful to people who may need government assistance. The other important feature of the program is that you don't have to receive Medicaid assistance to qualify to live in these buildings. And if you enter the building as a market rate or private paying person, you can stay until you've spent down your income and assets to the point where you may need government assistance, and then stay in that building. In traditional assisted living, once you've spent down your own assets, you can no longer stay there and you must leave. But supportive living, you can spend down, stay in the building, and often in the same room you were in before, and stay there. And it's a real big feature that is very attractive.
Well, you mentioned spin down. Now, I know what that means. You know what that means. Let's talk a little bit about how does that work?
Sure. Spin down is the term that's generally applied to people who have income above the assistance level needed to qualify for Medicaid. So if you apply for medical assistance, they will look at your income and your assets and determine whether or not you qualify for Medicaid. And if you do, they will tell you, well, you qualify now, but there are a certain number of individuals who apply that have income above and assets above, and they say you need to spin down or use your own private funds until you qualify for medical assistance. And for Medicaid here in Illinois, for a single person, that amount is $2,000, as it is in most states across the country. So you have to have assets no greater, and these are liquid assets, no greater than $2,000.
Okay.
And your income, as I mentioned before, can be no greater than $2,900 per month.
Okay. So, which in some cases, a lot of individuals I think, well, gee, that's not a whole lot of money to have put away, and that you're really almost at bare bottom.
You are, and it gets back to the whole philosophy of government and whether or not government would be expected to pay for you no matter how much money you had in the bank. And so it's a controversial thing, but generally speaking, our government is set up on the foundation that you must use your own funds to cover your situation to a certain threshold, and that threshold for the asset limit on Medicaid is $2,000 per month. $2,000. That's not income. That's just a bank account amount of $2,000.
Not to exceed.
Not to exceed $2,000.
Okay.
Right.
I do want to remind our viewers that our lines are opened, but I also want to give you more information on Mr. Smallwood. He is the Executive Director of Affordable Assisted Living Coalition in Springfield. His phone number is area code 217-525-0700. For more information about Affordable Assisted Living Coalition, you can also visit www.aalconline.org or www.slfi.com for exact locations as well for these locations and homes. Again, our lines are open, so if you have any questions for either myself or Mr. Smallwood, we'll be happy to take those for you. With all the changes that are going on today, and I think it's so important that we're here today sharing this information because we know there's a lot of people out there, and even our baby boomers, as we are. I am.
Me?
Yeah,
oh,
you
very
are.
much so,
Baby boomers. As we're out there looking at these things and the things that are happening and changing, there's so much information that's out there. But because there's so much of it, a lot of it doesn't make sense. So it's really good that we're here today and sharing this information with our viewers to let them know that these things do exist and this type of help is out there for individuals, especially for those kids today, again, to the baby boomers where they're now taking care of their parents. Many of who want to be independent but yet are living at home with their children. Not so much they don't like living home with their kids and grandchildren, but they're still independent and they want to be on their own. This is another option that they have.
Yes, and more we're finding the phenomenon where both children, the husband and the wife, must work, and it used to be the cliche in the industry that the best form of long-term care insurance was a daughter, and that's no longer the case. Now, often that daughter must go to work, and we're seeing that they're not able to care for mom and dad in their home as they once did, and so more and more we need options like this to offer for our seniors who are going to be living longer, and they're going to need this kind of service to thrive. And so we're very glad that the option is available for people here in Illinois.